The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. This is Ivania Woods. I'm the Missouri organizer for Reproaction, the organizer of this webinar. And I want to give folks a couple more minutes. I know that starting on time is important to respect everyone's time, but I want to give just a couple more minutes for folks to get in before we get started. So, 2 minutes. All right. Thank you. All right, so we'll go ahead and get started. Again, I'm Ivania Woods, the Missouri organizer with Reproaction, the organizer of today's webinar, and I'm really glad that you took the time to register and be a part of this webinar, to attend this webinar. We have some really good stuff in store for you. What I want to make sure that we get out of the way first is that everyone is on mute. Everyone will stay on mute throughout the presentation. And if you have any questions, just put them in the chat box and we'll get to them at the end during the Q&A. So originally this panel was going to be 2 hours, but we will get out of here early. So that is good news. Going to go ahead and share my screen. Everyone can cut off my webcam so you get to see me, and now you don't get to see me. All right, so here we are. I create content for what we call Maternal Mondays at Reproaction. It's every Monday. You can follow us on Twitter at Reproaction, REPROACTION. And I have here on the screen that hopefully you can see that my internet is acting really shifty. Okay, so let's see. I can make, yeah, here we go. Now you can see it. Okay, so this month, every Monday, you can follow us. We'll be sharing tweets about the following topics on those dates. And if you retweet or share our tweets or like our tweets, that's great. You can also create your own and use the hashtag Maternal Mondays. It just helps spread the word, share the information, and it's mostly educational material just for people to learn more about the specific topics and how they relate to maternal health. So that is something you can do to support our work. And we'll go ahead and get going. So today's panel we'll be talking about Black maternal health, considerations for a holistic approach. This webinar came out of me just thinking for our maternal and infant mortality campaign, how we can engage with people around pregnancy-related complications, but from a more holistic approach. A lot of the conversations we have are in relation to pregnancy-related complications specifically, and that conversation does need to be had. But there's so many things within the reproductive justice framework that we tend to in tending to Black maternal health. And so today we're going to talk about a few different topics, but again, you'll be on mute for the entire presentation. You can insert questions in the chat box. And just an overview, the reproductive justice framework is significant because it emphasizes the need to consider the holistic health of parents. In this webinar, health experts are giving brief presentations that cover a few issues important for maternal health and well-being. Topics will include the importance of birth control access, parental leave, and judicial bypass laws. We lost a panelist to this morning who is going to talk about the importance of and need to extend perinatal care. So if that is what you tuned in for, you won't get that today, but you will get it at a later date, so stay tuned. Which means that this panel is going to be of white women talking about Black maternal health. There's a few reasons for that, not just that we lost the one panelist, but even in constructing this panel, we all know it's just a numerical issue, that there's just more white women numerically in the country, but also who do this work. And people are overwhelmed, overextended right now. The election's coming up, so organizations who don't typically work on elections or work on voting are doing that in addition to their regular work. So I ran up against some issues there, and people's availability and their capacity right now is a huge issue. This isn't the only webinar I'm organizing, and it's an issue for all of them. But I am working diligently, and I do work diligently within the bounds of this campaign to ensure that panels are representative of the people that we're discussing. But this is the first time in like 3.5 years that a panel has been all white. But that's just how the cookie crumbled. I wanted to say a word about that before we get started for anybody who may feel a way about that. Just know effort was put into it. Effort is always put into it. And I am completely confident that the people on this panel are able to effectively and efficiently discuss the topics that they are going to talk about. But I do want to offer my apologies for those who may be offended by that, or just for people who feel a way about that. Just letting you know I acknowledge it, I recognize it, and in this case, it just could not be helped. The missing panelist is Brittany True Kellman. Here you can see a brief bio of hers. I did want to shout her out because she is a partner of Reproaction's organization. Her organization is Jamaa Birth Village. She is a midwife and a practicing doula. She trains doulas. They're located in Ferguson, Missouri. If you want to know more about True and the work that all of them do, like she's the executive director, but it's a team and they're within the community. It was created by a Black woman for Black women, and they're doing phenomenal work here in Missouri, which I'm located in Columbia. They're in Ferguson, but we do team up a lot for things. But the issue too with getting midwives on panels is that when there's a birth, they can't help missing it. So their participation is always pending that. So I did want to put up her information, the website, their Facebook page information if you want to go to their Facebook page and like it and support them there. Their Twitter handle is at JamaaBirth, JamaaBirth. The email info@Jamaa Birth Village. The phone number is 314-643-7703. So you do have all of that. She does phenomenal work. She's very relatable, and the only Black certified professional midwife in the entire state. So you can see how this goes back to the conversation I was having earlier about people being overwhelmed in the capacity, because there's just not a lot of women of color in general, and particularly Black women, who are doing this work. So that's that. So our first panelist today is Mandy Hagseth. And a little bit about Mandy is that they have 15 years experience in health rights and justice. Mandy serves as the Director of Policy and Advocacy at Missouri Family Health Council Incorporated, where she's held various roles since joining the organization in 2017. Previously, Mandy managed a diverse issue portfolio of social justice coalitions as the Director of Community Collaboratives at Community Partnership of the Ozarks in Springfield, Missouri, which is in the southwest portion of the state. And now she's in the central part of the state. She's also worked on sexual and maternal child health initiatives in the Dakotas and served as the Upper Midwest Human Rights Fellow to the UN Women Country Office of Liberia. Mandy holds an undergraduate and law degree from the University of South Dakota. And as our first presenter, Mandy, there's like so many freaking buttons. Y'all give me 1 second to make her. All right, she's off mute. All right, Mandy, you ready?
Can you hear me?
I can. I'm going to start the presentation now. And then you can just
Great, thank you.
And we'll move on to the next one.
Okay, perfect. Well, thank you so much, Avanya. Hello, everyone. I'm Mandy Hagseth, as Eva said. I serve as the Director of Policy and Advocacy for Missouri Family Health Council. First, I just want to say that I am grateful to be here and thank Eva, Erin, Pamela, and the whole Reproaction team, who MFHC is proud to partner with in mobilizing communities around Missouri. I am also especially honored to be invited alongside both True and staff. Obviously, I am very bummed that True is not with us here today, but both True and staff are visionary Missouri change makers doing truly awesome things. So just thank you so much for inviting MFHC to participate in such an important discussion today. You can go ahead to the next slide, Eva. Thank you. Great. So for those not familiar, let me tell you a little bit about Missouri Family Health Council and the small but foundational role that we play in holistic women's health. Missouri Family Health Council is a private nonprofit organization based in the Missouri state capital of Jefferson City, Missouri. And as you can see on this slide, our mission is to champion access for every individual to culturally sensitive, quality, sexual and reproductive health education and services. So we do this in two ways. We do it through programs and we do it through advocacy. While we ourselves don't provide direct clinical services, our two main programs are delivered through a network of health centers throughout Missouri that includes county health departments, community action agencies, federally qualified health centers or FQHCs, hospitals, standalone family planning providers, and also Planned Parenthood clinics. Most people know our organization as the grantee for the federal Title X family planning program, for which we have served as the sole grantee for the state of Missouri for just under 40 years. But excitingly, as of last year, we have also broadened the scope of our programs to include the statewide The Right Time initiative, which is a project of the Missouri Foundation for Health, and that I will dive deeper into in just a few minutes. So the Title X program provides contraception, contraceptive counseling, well woman and male exams, breast and cervical cancer screenings, pregnancy testing and counseling, STI testing and treatment, HIV screening, fertility counseling and referral, and also preconception health and education. And the Right Time Initiative offers free or no cost birth control of all methods to anyone who wants it, regardless of insurance or zip code. So in addition to our program work, which also includes training and support to health centers aimed at increasing quality of contraceptive services, we also do policy and advocacy work aimed at increasing health equity and improving access to reproductive and safety net services through engaging stakeholders, mobilizing communities, and just really working to advance a shared policy agenda. So as you can see on this slide, this kind of speaks to MFHC's geographical scope. It shows the coverage of our health center network and is also divided by program, those providing Entitled 10 services, those participating in the Right Time Initiative, and those participating in both. Missouri Family Health Council's total network includes 21 health centers and 87 clinic sites, which is a service area that covers more than 80% of Missouri counties and encompasses approximately 95% of Missouri's total population. Next slide, please. So let's talk about the need and importance of birth control within the context of Black maternal health. So first, it's extremely important to acknowledge in this space the ugly and unconscionable history of mistreatment and abuse towards people of color in this country and beyond that, specifically related to birth control, has led to distrust of birth control itself, as well as providers and the healthcare system as a whole. This history underlies our whole ecosystem and informs how people of color see the health system, how they have interacted with the health system, and really reinforces why reproductive justice sought to apply the critical intersectional lens of these lived experiences and identities. So we know that when people have the ability to control if, when, and under which circumstances they become pregnant, we know they're healthier. We know their babies are healthier. And we know that whole communities are healthier too. Bodily autonomy is really the foundation. It's core to self-determination, and without it, we cannot realize justice of any kind, especially reproductive justice. When people have bodily autonomy and lead self-determined lives, they can also create strong, healthy, thriving communities. So we know that women of color and people of color face major disparities in access to services, in maternal child health outcomes, and rates and severity of COVID-19. I know that not everyone here today is in Missouri, but Missouri especially really demonstrates these inequities and these systemic barriers. And reproductive health care itself also sees stark racial disparities. Black Missouri moms are more likely to die in the perinatal period, which, as an aside, I was excited to hear True speak to, because I may or may not have snuck into her panel yesterday at a different conference, and she just had some really interesting points and framing about perinatal health in general. We also know that the maternal mortality risk for Black women is 3 times higher than the risk for white women. We know that Black women are more likely to die from breast cancer than white women. Societal and health system factors contribute to high rates of poor health outcomes and maternal mortality for Black women, who are more likely to experience barriers to obtaining quality care and often face racial discrimination through their whole lives. As has been said a lot during COVID, racism is a public health crisis. So unintended pregnancy, that is pregnancy that's either unwanted or mistimed, as according to pregnant people themselves, can result in a host of different adverse health consequences, such as inadequate or delayed initiation of prenatal care, substance use during pregnancy, premature birth, low birth weight, poor breastfeeding initiation and duration rates, as well as negative physical and mental health effects for both mom and baby. Birth spacing is also an important consideration for maternal health. Women who have pregnancies too close together are at increased risk for complications, which include preterm delivery. Patient-centered contraceptive counseling allows for people to choose the path best for themselves with appreciation of health considerations for both mom and for baby. It creates a safe space for all to access non-judgmental and empowering care based on trust and based on autonomy. So there are a lot of critical considerations at this intersection of health equity, Black maternal health, history, and the future, especially as issues of racial injustice continue to permeate our social and political landscape. Next slide, please. So all of that said, let me tell you about the Right Time Initiative. So the Right Time Initiative is a 6-year project. It's funded by the Missouri Foundation for Health, and it's based on the simple belief that everyone should have the opportunity to pursue the future they want, including if, when, and under what circumstances to get pregnant. So recognizing that decision always rests with the patient, the effort, really through education and awareness, aims to empower individuals to take control of their own health by improving information about and removing barriers to contraceptive services. In addition to reducing health disparities, increasing health equity, reducing unintended pregnancy, and removing barriers, the initiative also seeks to achieve the following outcomes. Kind of most dominantly, it seeks to empower Missouri women and families in their own healthcare decisions. Also, it seeks to increase availability of same-day contraception. On a clinical level, it increases clinical capacity in areas of contraceptive counseling, clinic flow analysis, coding and billing, all these like clinic-specific items, best practices for managing inventory of contraceptives. And then on an environmental or a sustainability level, so after the initiative, it seeks to remove the policy barriers that make this work or sort of impede this work, and seeks to improve the financial stability to support safety net health services, which excitingly, there's not a lot of good news these days, so we can celebrate that here in Missouri. In our August election, the Missouri voters approved expanding Medicaid, making Missouri the 39th plus DC state to increase or expand Medicaid. So that in significant part will help us achieve the removal of policy barriers to increase the sustained positivity that the initiative seeks to make. So in 2019, we launched our first network of health centers participating in the initiative, and we just completed onboarding for the second, which brings us to a total of 12 health centers throughout the state of Missouri that are participating in the initiative. And these health centers are located all over the state, with the exception of the Kansas City metro area, which is not in the Missouri Foundation for Health Service area. So we have access in the Northeast, Southeast, Southwest, Mid-Missouri, and then throughout the St. Louis metro area. Another component of the Right Time seeks to harness collective power to advance shared policy goals that ultimately increase contraceptive access in the short and long term. These are measures like expanding Medicaid, as I mentioned, promoting and streamlining the state family planning program, extended supply or 13-month prescribing of contraception, improving confidential billing practices, et cetera. That's just an example. And Reproaction is among our community mobilization partners who join us in this work. We also have a robust communications campaign led by the national organization Power to Decide, and an equally robust evaluation component. So we can measure progress and impacts of the initiative and really continuously learn and improve throughout this 6-year process. So look, we know that contraception is not going to solve the Black maternal health crisis, but it does remove one small barrier to creating more equitable access to quality, affordable care. And it does apply the right lens on how we can better do this work from a place of equity and centering patients, and specifically centering women as it relates to maternal health. Next slide, please. So this quote, which has made its way kind of around the internet in the very, very sad wake of Justice Ruth Bader Ginsburg's death, really sums it all up. Missouri Family Health Council, the right time, and considerations for Black maternal health are all centered on this. The decision of if, when, and how to have children is central to one's dignity, and it just determines so much more. Next slide, please. So just a little shameless self-promotion to close. Missouri Family Health Council is hosting a public training event on October 14th from 10 a.m. to 11 a.m. Central Time, exploring racism and implicit bias in healthcare. The training features presenter Sura Masood with the Diversity Awareness Partnership, and is going to discuss strategies to reduce harmful impact of unconscious biases on reaching organizational goals. Just wanted to put out to all attendees today, all are welcome, and you can register at mfhc.org to participate. We'd also encourage attendees to check out our new and fabulous website at mfhc.org, as well as our sister site a couple of slides back, therightTime.org, which if you are interested in seeing where you can access free or no-cost birth control at Right Time Health Centers throughout Missouri, therightTime.org does have a clinic finder that can help you locate the clinic closest to you. And next slide, please. So here is our contact information. Again, I just want to thank Avanya and Erin and the Reproaction team for inviting Missouri Family Health Council to the table today. Obviously, this panel is just further evidence of how much we all need to work collectively to uplift Black voices and Black women specifically, and work together to improve Black maternal health in Missouri and nationally. So thank you all so much.
Thank you so much, Mandy. That's actually a really good point that you make about how we need to uplift and support Black women in this work. I want to ask you a question related to our current situation with COVID-19. I've been on a lot of webinars talking about how COVID-19 has exacerbated issues, health-related issues particularly, but I've yet to be on one that talks about how COVID-19 has exacerbated the contraception gap. Do you have any suggestions, or like how has COVID-19 exacerbated the contraception gap? And do you have any suggestions for how we could address those issues?
Yeah, that's a great question. Thank you so much for asking that. Yeah, the ongoing COVID-19 pandemic definitely highlights so much, but also how critical access to contraception is throughout the United States and world. You know, there was a recent report that found that 1 in 3 women in the US have delayed visits to a healthcare provider for sexual health services and/or experienced additional challenges accessing birth control during the pandemic, which disproportionately has affected women of color. Yet, at the same time, more people in this, kind of landscape are also seeking to prevent or delay parenthood. So COVID-19 has really amplified those barriers and inequities in our healthcare system, especially given higher rates of COVID among communities of color. So inside health centers, especially family planning service providers throughout the pandemic, we saw a number of different impacts, such as like consolidation of clinic sites, staff being reallocated to deal with frontline COVID-related services, or in a lot of cases, furloughed. There was a reduction in staff in some places as well. Also, we saw a reduction in clinic hours. The whole healthcare system was obviously and continues to be strained by this global pandemic. But thankfully, many providers, especially those delivering family planning services at Title X or the Right Time Health Centers, really pivoted to and expanded telemedicine options, and also were able to use and are able to use the mail system to mail contraception. And most are still seeing patients in person because this is essential healthcare. So that's a great question. There has no doubt, family planning or contraception has, like everything, not been immune to feeling the considerable impact of this health crisis. And telemedicine and committed, fantastic providers here in Missouri specifically have been really exceptional in sort of alleviating some of that impact. So great question. Thank you.
All right, thank you for such a phenomenal response. All right, next up is Stephanie Kraft-Sheley. I know Stephanie from her incredible work. Though she resides in Illinois, she does a lot of work in Missouri, and that's how we get to team up on things. So Stephanie is an attorney and advocate for reproductive justice in Missouri and Illinois. She focuses on developing full spectrum legal and practical supports for young pregnant people. She earned her JD and MHA from the University of Iowa, and her original comic appears in Comics for Choice, Illustrated Abortion Stories, History and Politics, which was published in 2018. Stephanie is going to be talking about judicial bypass laws. And so I'll hand it over to you, Stephanie.
Okay, can you hear me?
I can.
Great. Thank you so much, Ivania, for inviting me. And I just want to echo Mandy's sentiments about being excited to present among these amazing advocates. At the same time, I also want to join you both in acknowledging that the makeup of this panel highlights the need to commit ourselves to uplifting Black advocates. That's clear. So today, I'm going to talk about what parental involvement in abortion laws are, the judicial bypass process, how these laws affect Black maternal health, and then the national landscape for youth access to abortion and resources that have been created and are in development to help young people navigate this process, as well as pregnancy in general. Next slide, please. Thank you. So parental involvement laws are laws that require young people, usually under the age of 18, to either notify a parent or other adult family member that's named in the statute about their abortion before it happens, or to seek a parent's consent, so their permission for abortion. And the requirement to either notify or gain consent varies by state. Notification is considered to be a less restrictive requirement for young people, but that isn't always the case, because young people, once they've notified their parents can actually place barriers in their path of accessing abortion. So functionally, they can be similar, if not the same. The alternative to notification or consent is to get a judicial bypass, which means a young person goes to court to convince a judge that they're either mature enough and well-informed enough about abortion, or that it's in their best interest. So something about their circumstances makes it clear that it's not a safe option for them to involve their parents. And what we know is that forcing parental involvement or engagement with the legal system is harmful. young people overwhelmingly do involve their parents if it's safe, regardless of what the law says, and those that don't have a very accurate assessment of whether that's a safe thing for them to do. And then having to engage in the legal system can also be quite harmful. Young people have reported that it's humiliating, traumatic. They experience it as a punishment for sex and for pregnancy. And they may be subjected to anti-abortion stigma through that process. And then for some young people, the legal system is just simply not a safe institution given their prior experience. And of course, that can be particularly concerning for communities of color, undocumented communities, LGBTQ people. And these laws assume a narrow definition of supportive family relationships in which adults are safe to involve. So for those young people that don't involve their parents, I've often found with my own judicial bypass clients that have talked to trusted adults. They typically do, as part of their process, seek out adult counsel if necessary, just maybe not the particular adults that the law says that they have to tell. We also know that there's a disparate impact of these parental involvement laws on Black young people. A study from Arkansas showed that among people who went through the judicial bypass process, so went to court to get judicial permission for abortion, Black young people on average access abortion over 2 weeks later than white young people. And they're also much more likely to have second trimester abortions, which carry a higher risk of complications and are typically more expensive. So this does have a particular impact on all young people, but Black young people seem to be bearing the worst experience of this process. And there's also a connection here to maternal mortality. This is an age-specific barrier in the way of accessing abortion, among other more generally applicable barriers that exist. And with such a high maternal mortality rate nationwide and a significantly higher maternal mortality rate for Black people than white people, it's a system that actually tries to prevent abortion and force people to remain pregnant, but then again, kind of entraps them in a situation that might seriously harm or kill them. And that possibility is much higher for Black women, Black people who are giving birth. Next slide, please. So this map shows the parental involvement laws that exist. So the dark colored states are those that do have parental involvement laws, and there's a mix of consent and notification laws. And then the light blue are laws that do not have or states that do not have parental involvement laws. And as you can see, the center of the country is just a swath of dark blue. Meaning that in many states, young people don't have a simple option to avoid either telling their parents or going to court by just simply going to a state that doesn't have those requirements. They actually would have to travel a great distance or choose to go to their state or a surrounding state that does still require them to go to court. And these states, just a note on consent and notification. What notification can look like is a clinic having to send out a certified letter to the parents 48 hours in advance of the abortion. What consent often looks like is a requirement that the parent provide consent, which the clinics will then, in order to comply, require the parent to appear in person and provide identity documents for themselves and then some document that links them to their child. So if they don't share a last name, they may require a birth certificate, marriage or divorce papers, or other documentation supporting the fact that they are actually one of the people that is eligible to provide consent. So you can imagine how in that situation, young people who actually do have their parents' support with this decision would also not be able to gain that consent because they can't comply with the specific requirements of providing consent. And then next slide, please. So looking closer at Missouri and the states surrounding it, they all have parental involvement laws, and they have slightly different laws and differing levels of support for judicial bypass. So for example, Illinois requires notification, and it requires notification to parents, biological parents, step parents that live with you, grandparents, legal guardians. So like a fairly wider range than is typical of people who can receive that notification. And it also has a robust, dedicated judicial bypass project where there's the ACLU of Illinois has an attorney who is employed full-time to manage these cases. So they will take clients on and help them through the process. They also have developed relationships with clinics throughout the state as well as courts so that they can make that process as seamless as possible for young people. So contrasting that then with Oklahoma, which has both notification and consent requirements, and only the consent requirement is waivable through the judicial bypass process, which means that a young person can go to court and get permission from a judge to choose abortion without their parents' permission. However, they still have to tell the parent. So for some young people, if the concern for them is that their parent would find out about their pregnancy status and maybe kick them out of the house, harm them physically, or prevent them from having a relationship with siblings or things like that, those harms can still befall them. And the parents can still attempt to prevent them from accessing an abortion appointment, even though they technically aren't required to have their parents' consent. So there really is a wide range, and outside of Illinois, the typical means of accessing judicial bypass in these states is to call the clinic, and then the clinic will help a young person arrange access to the courts, either by helping them find an attorney or finding other support resources. Next slide, please. So then looking even further into Missouri, Missouri requires parental consent plus notification under limited circumstances, depending on the custody status of the young person, like parental custody. And Missouri also has this aid and assist law, which creates civil monetary penalties for helping a young person get an abortion without either parental consent or judicial bypass, even if it's legal in another state. So this has created fears among individuals that might wish to help family members or friends leave the state by giving them a ride or money to help them get an abortion when it's hard for them to access in Missouri. It's also created a chilling effect on advocates who are nervous about how this law might apply to their efforts to help young people access abortion. In addition to that, there is one abortion clinic in Missouri on the far east side in St. Louis, and several other barriers that apply to all ages seeking abortion. For example, the 72-hour waiting period that requires people to make 2 trips to St. Louis if they don't live in St. Louis to appear at the clinic in person in order to have an abortion. And so this relates to Black maternal mortality, in addition to the concerns that similar might be the case that the judicial bypass process could, for young Black people, delay their access to abortion even further. So because of the barriers in the way of in-state abortion and the state's attempt to entrap young people within the state with the aid and assist law and force them to continue their pregnancies. And because Missouri has one of the worst maternal mortality rates in the nation, and the disparity in maternal deaths between Black and white people is significantly larger than the disparity even in the US as a whole, it really starts to feel like there's a particular concern for young Black pregnant people that they're going to be forced into pregnancies, and then those pregnancies could present harms and risks to their health. So that said, next slide, please. So the traditional model for providing judicial bypass support is particularly freestanding organizations that focus on judicial bypass, is for there to be an organization that young people can get in touch with by call or by text, and then that organization will provide a referral to an attorney who is trained to handle judicial bypass cases, who can advise them on their legal rights and help them with the bypass process. The organization typically will also help a young person arrange an appointment. Sometimes young people are constrained by school hours, or they still have to access this appointment without tipping off their parents that they're doing that. And so the organizations can help them kind of figure out how to arrange that and work with the clinics, and then help connect them with financial support that they may need. So that's kind of the typical scope that judicial bypass projects take. There is one in Texas, Jane's Due Process, that kind of expands beyond that and helps people understand birth control and get access to better sex education. And so they're kind of expanding, but the typical model is this like very close focus on the actual judicial bypass process and access to the abortion. And they've been amazing resources for people. It's probably the only one way some people would get the help that they need. But at the same time, my experience as a judicial bypass attorney has shown me that some young people feel like there actually is not much of a choice or not much support for them to make another decision, because there's so little support for young pregnancy and young parenthood as they look around at their options. And in that context, they're making a fine choice, and in any context, making a choice to get an abortion should be supported to that full extent. Access to legal advice as well as help through the process. But looking at it from a reproductive justice perspective, wouldn't it be great to have one organization that pregnant people could turn to that could provide that same level of support regardless of the pregnancy decision being made? And so that's the proposition, next slide please, of a project that I'm working on. I'm developing a text line, and it's somewhat modeled off of the other judicial bypass text lines that exist around the country, but it decenters abortion and places it among the range of options that are available. So really centering all young pregnant people, regardless of their pregnancy decision, and acknowledging that Black, LGBTQ, and people of color face particular barriers and harms when trying to access or avail themselves of any of these options. So functionally, the idea of the project is to be able to provide accurate legal information about any of these options, taking into account the unique legal status of a young person who may or may not have the rights afforded to adults, and also then provide vetted, non-judgmental referrals to supports that they may need to effectuate their choice. So this is the thesis that I'm operating under in moving forward with this project. However, with that, acknowledging that it's vital to seek input from those most affected on both the concept as well as the form and function of this resource, and to pay money for that input. So that has been built into the development plan. And the task is to recruit young people and prioritize people of color and LGBTQ youth and follow their expertise on what particular needs exist and the way to provide information in a digestible, accessible format. So the ultimate hope for this project is that it will help address the concerns of young pregnant people, you know, who, like I said, don't have the full legal rights that adults have, but yet are still responsible for making their own decisions about their pregnancies. And like I said, taking a very close look at how the structure of this project is honoring and uplifting the most vulnerable populations. And ultimately, the goal is to support a person in making a decision that honors who they are and what their goals and values are in their life. And with that, that concludes my presentation.
Thank you so much. It's exciting to hear about the text line project that you're working on. I heard about it, you know, a few months ago from you, but I like this format. I like the model that you're using. So in thinking about judicial bypass laws, I'm thinking about how teens are at the center of this. They're the ones who are most directly affected. And of course, one of the principles of intersectionality that the reproductive justice lens is rooted in is centering the most marginalized, which is contextual, depending on, you know, what issue it is. And in this particular issue or this particular of judicial bypass laws, it would be teens. So I'm wondering, what are some ways that teens can not only be at the table, but help lead the work and shape decisions?
Yeah, I think it's crucial that that be the case here with this project. And so, and that's been a big challenge as I've moved forward with this, because bringing young people to the table in a non-exploitative way is challenging. And I think the only way to do that in a way that honors reproductive justice is to compensate them for their input and their leadership and expertise. And so, I mean, I have gone, you know, to the extent of getting that funding so that we can do that. And then, you know, of course, thinking through like the fact that I'm still the one that's responsible for doing that recruitment and doling that out. So that's kind of a challenge and a concern that I'm working through at the moment. But certainly young people have to be at the table, and young people who represent the most vulnerable groups among young people have to be at the table if this project is to actually meet its aims, which are to, you know, provide a valuable resource that really gets at the concerns that these young people have. But I think like step one is paying people for their input. And then I think as time moves on, I think transitioning this to some sort of co-leadership structure, or like handing over leadership entirely to someone or a group of people that is closer to the affected population would probably be the ideal scenario as this project moves on and evolves.
Oh, that sounds amazing. I know too that you were looking for young people to be a part of this. Did you get enough young people? Are you still seeking young people to help out?
I am still seeking young people to help out, you know, ideally from different places around Missouri. And that's definitely, so yeah, if anyone knows any young people or is a young person that would be interested in participating, I do have stipends to offer for that participation.
And how may they contact you to help out?
Yes, that should be on this slide. My email address is Kraft, Kraft, Sheley, SHELEY @gmail.com.
All right, thank you so much. I'll probably ask you to repeat that at the end for people who maybe didn't get it down now or who will want it later. Thank you so much for your presentations. Very insightful, impressive as usual. Thank you. Our next panelist is one of the co-founders and co-directors of Reproaction, which is a national group using bold action to increase access to abortion and advance reproductive justice, Erin Matson. Erin previously served as the Action Vice President of the National Organization for Women, as well as the Editor-at-Large for Rewire News. Erin serves on the steering committee of the American Society for Emergency Contraception and recently completed 3 terms on the NARAD Pro-Choice Virginia Foundation Board of Directors. And today, Erin will be talking about parental leave, which is super important. I feel the reason that I wanted to include that in this webinar is because a lot of points of education or conversations and dialogues that I've been a part of talk about parental leave, but it seems to be really heavily focused in the economic justice arena where people look at it through an economic lens. And I really wanted to pull out how, through a reproductive justice lens, we can be thinking about and incorporating parental leave, the need for, the importance of it in our work. And so Erin's the perfect person for that. So Erin, if you're ready, you can get going.
I'm here, and thank you so much, Ivania, and thank you to Mandy and Stephanie for those extremely informative presentations. It's an honor to be on the line with you all, and I also want to echo that I'm bummed that we weren't able to share space with True, and that this panel was not what Ivania worked so hard to have today. At the same time, I also want to say that while I echo what all the other speakers have said about uplifting Black women doing the work, that it's also incumbent that as white women that we don't shunt the work to Black women to resolve racism, and this is something that we've got to take on and do the work as well. So thank you to Eva for weaving parental leave into the crucial conversation on Black maternal health outcomes. And next slide, please. Okay, that's me. I use she, her pronouns, but and I am based in Arlington, Virginia. However, at the moment, I am in my original home state of Minnesota, so my Midwestern accent is, I think, cranking up every day I spend here. And I am on Twitter at Erin to the Max. Next slide, please. So Eva already talked about us, Reproaction. I'll just lift up a couple of things about us. We're proud of our left flank analysis. We're known for our willingness to hold folks on all sides accountable, whether they're traditionally considered allies or opposition. And we have a deep commitment to nonviolent direct action as one of the tools in our toolbox for bold action to increase access to abortion and advance reproductive justice. Okay, so first, let's be very clear that the status quo is discrimination as pertains to parental leave. The United States does not guarantee paid parental leave to all, and many workers are not even guaranteed access to unpaid parental leave, which truly isn't actually leave, but they don't even have that. Access to paid parental leave is a reproductive justice issue. Birthing parents need time to physically recover from childbirth, bond with and care for their babies, and learn how to rebalance their lives with their new obligations. And due to structural discrimination impacting all areas of their lives, Black women tend to be the most adversely impacted by lack of access to paid parental leave. Next slide, please. So impacts on maternal health. So just as Eva was saying, this is not just an economic issue, although it's a glaring, burning one. It's a reproductive justice issue. Studies on paid family leave in the United States and other countries show that long and short-term benefits for paid leave for mothers and children include fewer low birth weight and preterm births, increased breastfeeding, reduced rate of hospitalization for infants, and improved maternal health. Next slide, please. And we need to have a conversation about this against the backdrop of the racial wealth gap. The typical white family in the United States has more than $140,000 in wealth, whereas the typical Latinx family has $6,300, and the typical Black family has $3,400. These gaps have a direct tie to the impact of not having access to paid family leave and therefore continuing economic as well as physical health. So recall how earlier I talked about how people in the United States don't have guaranteed access to paid leave. Many workers don't even have access to unpaid leave. And this shows how truly worthless unpaid parental leave can be, in that people truly, and especially Black women, depend on having paid leave in order to be able to take leave at all. Next slide, please. So let's talk about the existing policy that we have. The Family and Medical Leave Act was passed in 1993, so it's been a bit since we updated this law. It provides up to 12 weeks unpaid leave for eligible employees to care for seriously ill family members or for the arrival of a child. And it applies only to public agencies and employers with 50 or more employees, covering just 60% of the workforce. Next slide, please. Now, more recent, beginning literally tomorrow, is the Federal Employee Paid Leave Act. It provides 12 weeks of paid leave for federal employees following birth or placement of a child, and employees must be in service for 1 year prior in order to be eligible. This covers 2.1 million workers. And why is this important? Well, it matters deeply for those 2.1 million workers. Often what happens in the federal sector is something that can help creep into the private sector, and more importantly, it shouldn't be up to the whims of an individual employer. It ought to be the law. This provides a template for federal policy that would truly cover everyone. I want to highlight that this requiring people to have service for 1 year prior to eligibility for paid leave makes no sense. Similar to the way healthcare and through the Affordable Care Act, we began to identify at a more systemic level, not just at the activist level, but in policy circles, that it was untenable to tie health benefits to an employer, that people need health benefits throughout their lives. Same thing, people need access to paid leave throughout their lives, regardless of what time they may or may not have joined an employer. Still, this is an important step and something to celebrate starting tomorrow. Next slide, please. So let's talk a bit about what's happening in the states, because access does vary by states. 8 states and the District of Columbia offer paid family leave. Those states are California, Connecticut, Massachusetts, New Jersey, New York, Oregon, Rhode Island, and Washington State. Now, I want to challenge you to create a Venn diagram in your mind of which states offer paid leave and where Black women live, and where, not just that, but where maternal health disparities are highest and outcomes for Black women are the lowest. What do you notice? And certainly, while there are some areas where there are high concentrations of Black women and need where paid leave is available, in many parts of the country where this is desperately needed, it is not available. Next slide, please. Okay, so solutions. So the Federal Family and Medical Insurance Leave Act, or it's called the Family Act. This is something that's been championed by Senator Kirsten Gillibrand, creates a national insurance program for up to 12 weeks of a partially paid leave for serious health conditions or that of a family member or the birth or adoption of a child. This is funded by both employee and employer payroll contributions. So this would, this also includes state and local initiatives to provide deeper paid leave. It expands protections to workers in small businesses where many employees actually work. Another piece is that we would need community organizing and pressure on employers. Employers shouldn't get a pass for not providing comprehensive paid leave to their employees. And most of all, we need to center the needs and lived experiences of Black women in family policy in the United States and create a new paradigm where all families can thrive. And that is it for my prepared remarks. Thank you.
All right, thank you. Yeah, so Erin, I want to go by and make this big again because y'all should follow us on Twitter. Let's see. So you've detailed why family leave would be beneficial, but what are the arguments against parental leave? And what I really want to know is like what is keeping us from getting this more widespread in the United States?
Yeah, well, the ultimate root cause is patriarchy and white supremacy. This idea that capitalism exists in a vacuum and that there aren't people with needs who need to be taken care of. But the primary argument that's being used publicly against it is that employers can't afford it and the country can't afford it. So, as I said, the key challenge and obstacle is patriarchy and white supremacist patriarchy in particular, and an idea that issues affecting women and families and issues that are really important to Black women are somehow separate from growing the economy, even though women and families are the economy. And we've seen that reflected in the pitiful lack of support offered to families in COVID-19 relief packages. I also want to acknowledge something that's come out a bit out of the fake feminism quarters. So for many years, the right wing was openly anti-feminist. Now they have created these astroturf groups that represent the right wing that pretend that they represent women's interests. And folks may remember that a few years ago, Ivanka Trump, the president's daughter, acted like she basically discovered that parental leave issues existed in this country. And there was a flurry of these anti-feminist astroturf groups like the Independent Women's Forum is one example, that just represent the right wing but pretend like they are representing a base of women. They were creating these leave proposals that were very bad faith. They did not extend to the leave to the people that need it most. And instead, what it was a mechanism. I talked about the Family Act, where there would be payroll contributions both from employers and from the government if that was to go into effect, similar to the way that Social Security and healthcare programs are paid for. Instead, these fake proposals that were put forward would be paid for by robbing Social Security. So in other words, having people withdraw money from Social Security in order to take paid leave. And I want to talk about why this was so cynical. The right wing has long had a goal of ending Social Security, period. So this wasn't a real plan to begin with, but rather a Trojan horse to fulfill other objectives. So in summary, the key challenges and obstacles that are keeping us from getting the parental leave that we need are at core white supremacist patriarchy. It's reflected, and that bubbles up then to a lack of both fair as well as diverse representation in our policy corners. But I do think that the tide may be changing.
Okay, that's good to hear. Leave us with a little bit of hope. So I want to thank every presenter for providing such insightful work, taking the time out of your Wednesday morning/afternoon to do this. So we're entering the Q&A. I want to remind attendees, if you have any questions that you want to ask, please put them in the chat box. Thinking right now, I have one question, and this one is for Stephanie, and it's from Coy Flaker. And she wants to know, are there leaders in schools who offer this kind of information for teens, or is it mainly word of mouth from teen to teen?
Did you say, are there leaders in schools?
Yeah, like who offer information?
Was that the question?
Yeah,
Okay.
about judicial bypass laws and how to get abortions and things like that, or are teens relying on other teens to give them that information? Like, how is that information getting to them?
It varies by state, and I can speak most clearly on Missouri. I mean, I can say, like, for example, Jane's due process in Texas is they take multiple different approaches to get the information out to young people, including like having a presence on TikTok, and they do a lot of ads on social media, and that seems to be effective for them. Here in Missouri, in terms like in I don't know what they do in schools or what they're able to do. In Missouri, people employed in the public schools are forbidden from assisting or counseling anyone to get an abortion. So my assumption is that if that's happening, it's happening quietly. And there is probably a lot of concern about, I mean, there would be no possibility of having like an open collaboration with the schools because of that in Missouri at this point. And yeah, and I don't know that this travels by word of mouth between young people. I think that what happens a lot of times is the young person finds themselves pregnant and then calls a clinic, and the clinic is the first one to let them know that there's this parental consent requirement and what the judicial bypass process is. That's my understanding talking to other advocates. But I think like this is a huge reason why we should talk to young people about this and find out, you know, what they do know and what information they are sharing amongst themselves.
Yeah, that's important. Okay, so I have a question for everyone on the panel. So for most of the last 50 years, progressives have been on the defense, and the opposition has been successful in creating many obstacles. So my question is, how might we get on the offense and push for progressive changes on these respective topics? And you can go in whatever order you'd like.
I'm happy to go. This is Erin. First, because I ended without substantiating on Eva's question why I thought the tide might have capacity for change. And that's specifically because on the question of parental leave, due to the horrific epidemics of coronavirus and systemic racism in this country, we are in a movement moment because people see very clearly and cannot miss it that the system is not working. I've been talking about paid leave, and given the caregiving crisis of this moment that is impacting so many families that are unable to access childcare or even send their children to school, and also the potential for change in who holds the levers of power, we have an opportunity, and in addition to that opportunity, we have a moral obligation to push for what I've been referring to as a parents' New Deal that would increase resources and support so that working families can thrive, centering the needs of the most marginalized communities.
I like that. Parents' New Deal. I'm writing that down. Yeah, so Mandy, would you like to go next? The question is just asking like
Sure.
how progressives can get on the offense and push for progressive change in like birth control access specific to what you're talking about today.
Yeah, I mean, I think kind of just broadly, I really do think, kind of to Erin's point a little bit, that especially given the totality of everything going on in this moment, that we have to continue to mobilize grassroots communities and work to change the face of power in Missouri and the country. Look, the opposition has been successful in creating obstacles in part because they're good organizers. You know, we need our doctors' offices, our state legislatures, all levels of office, our courts, our panels, you know, to really be reflective and representative of diverse demographics, attitudes, lived experiences. Change doesn't come from the top down. It comes from the bottom up. And I guess I would just encourage attendees out there, those of you still with us, to stay here, double down, and encourage your networks to get even more involved and at all levels, and keep fighting. I know that everybody is tired. I know that everybody is sick of feeling very unheard, but to Erin's point, this is a movement moment and your voice matters, and there is an election of a lifetime on November 3rd, and everything is on the line.
That is, oof, can't emphasize that enough. Please vote, everybody. I have my absentee ballot. I'm going to mail it today. Stephanie, did you want to speak to that question?
Yeah, sorry, having trouble getting myself off mute. Yeah, could you just briefly repeat?
Yep, I sure can. So I was talking about how for the last 50 years, progressives have been on the defense and the opposition has been successful in creating obstacles. So how might we get on the offense and push for progressive change on, for instance, getting beyond judicial bypass laws?
Yeah, I mean, I think that that's one thing that I've noticed when I'm in meetings with like the Missouri coalition that kind of meets about the issue of youth access to abortion. There are frequently concerns expressed that like rocking the boat will make the legislature, like if we create a better resource for young people, that they'll just come after that and try to regulate that out of existence. And kind of almost the end of that sentence that doesn't get said out loud is, so we just shouldn't try. And I think that we have to stop that. I don't think that that's useful. I think they've already tried to regulate everything out of existence. And I think that like continuing to push through, even though it does feel legally tenuous or legally risky or potentially someday legally risky to create these resources, if we don't do it, then we're just really placing the burden of navigating this back on the people with the least power and highest level of vulnerability. So I would say that. And then in terms of developing a more holistic resource, you know, I've had surprising amounts of pushback from people on our side who are, I'll get like, know your role in what you're doing, or just like a lot of concerns that we don't know how to vet these organizations that provide these other types of resources, because we really just know the abortion focused organizations and not the ones that are focused on pregnancy and birth. And not like feeling like that's out of our comfort zone is not a good reason not to try to place abortion within its larger context and place it back into a spectrum of healthcare needs that people have with respect to their reproduction. And I think that's really the direction that we need to move in to support people's really diverse reproductive needs.
All good points. Okay, so I don't see any more questions in the chat box, and I don't have any more questions like specific to any particular issues, but I do want to give each of you an opportunity to go back through how attendees can support your work and help you extend your platform and reach more people. So Mandy, if y'all just want to go in the order that you presented in and just repeat that information one more time before we end this webinar, that would be fantastic.
Awesome. Thank you, Ivania, for another opportunity. I would just encourage attendees from the perspective of Missouri Family Health Council. We do have a new and fantastic website, mfhc.org. And also, as I had mentioned in my presentation, therightTime.org is a location or a website that people can go to find out here in Missouri which clinics can offer access to free or no cost contraceptive services. So between mfhc.org and therightTime.org, there's a lot of valuable information that I hope attendees seek out. And then also, thank you again, Eva, for putting it back on the screen for a bit. Our Exploring Racism and Implicit Bias in Healthcare training on October 14th. It's going to be fantastic. Surah Masood with the Diversity Awareness Partnership is fantastic. It's free, it's open to the public, all are invited, and you just can sign up on mfhc.org. So thanks again to all of you. We just really greatly appreciate the opportunity to be a part of this, and it's just been really fantastic and a great Wednesday. So thanks to all.
All right, and so Stephanie?
Yeah, so I would say the two things that could be the most helpful are if you're part of an organization that that serves young people or addresses the unique needs that young people may have with respect to pregnancy and birth or early parenthood, particularly in Missouri, or if you provide services that that folks from around the country can access, I'd love to speak with you. Or just I've really been gathering up as much information as I can from people who do work with young people about structuring this resource and you know, different considerations to take as it moves along. So I really love that input. And then the other thing is, if you work with young people in Missouri and know of any that would be interested in a paid opportunity to provide input, I would really love to be connected with them as well. The best way to contact me again is my email address. I was remiss in not putting it on a sign, but I will say it now, or on a slide, but I will say it now. It's Kraft, Kraft .Sheley, SHELEY @gmail.com.
All right, thank you for that again. And I'll wrap up on Erin's behalf. I do want to thank everybody again for presenting. And as we wrap up, this is just like a Reproaction general wrap up. You can sign up for Reproaction alerts by joining our listserv. Go to our website at reproaction.org. You can follow us on social media. We are on Facebook, we're on Twitter, we're on Instagram, and at each and every one of those social media sites, our handle is at Reproaction, REPROACTION, one word. The A is not capitalized, as you can see. And you can engage with our organizers, including myself. And feel free to follow Erin personally. On Twitter, her handle is at Erin to the Max, ERINTOTHEMAX. My handle was on the first slide. It's at Ivania Star, EVONNIASTARR. And that actually wraps us up for today. I don't see any more questions in the box, so we'll go ahead and end it there. Again, I want to thank all of the panelists and all of the attendees for taking time today to join this webinar. Oh, one last thing. We have a webinar that you can go to. If you follow us on Twitter, or you go to our Facebook, you can go. If you join our email list particularly, you'll definitely get this. We have a webinar next Wednesday, which is at 3 p.m. Eastern. It's 1 hour. It'll be 3 to 4. And I'm organizing that as well. We'll be talking about how the conversation around abortion access needs to be extended beyond the legality of Roe, right? So we're not necessarily focusing on Roe v. Wade, whether it gets overturned or not, because access to abortion goes far beyond that, and we need to make this a more comprehensive conversation. And I have some really great panelists for that. Both Pamela and Erin will be a part of that as well, along with myself. And I want to assure you, I worked so hard on it, and it's going to be so good, y'all. So if you can see about making that. And I'll go ahead and wrap this up. Again, thank you all, and have a good week, because hopefully you'll be back next Wednesday. All right. Bye.